Hi, my name is Emily and I'm going to be the student nurse today. When I enter the patient's room, I would begin by verifying their name and their date of birth and also verifying any allergies. Since our wound's on a box, I will not be able to do that today, but again, verbalizing that I would do those things. And then I would also verify the physician's orders for the sterile wound dressing, make sure that I have the correct patient that he wanted those for, and that I'm doing them at the right times, things like that. I would also do a quick pain assessment on the patient. If they did have any pain, I would get some orders for a pain medication and administer those about 30 to 40 minutes before I would begin the procedure. I'm going to go ahead and do some hand hygiene here. I'd also need to locate and determine the location and the size of the wound. Mine's clearly just on a box, but if I had a real patient, I would be doing that. Before I begin anything else, I'm going to go ahead and raise the bed to working height, and then I'm going to provide some patient privacy. Before I begin looking at the wound, I'm going to just explain the procedure to the patient, let them know that I'll be doing a sterile wound dressing. It should only take about 10 or 15 minutes, and that if they have any concerns while I'm doing it, just to let me know. So the dressing is on already, the old one is, and before I begin looking at that, I'm going to go ahead and set up my biohazard bag. And I'm just going to set that over to the side of my patient. This is a little tricky to set up because generally I wouldn't want to reach across my patient and stuff like that, but we'll do this setup for now. And then before I begin, I'll do some hand hygiene. And then I will be loosening up the tape on the previous dressing. Before I would have done that, I would have put on my exam gloves. Forgot that step before doing that, but I would have put on exam gloves. And if I had some here right now, I would put on my exam gloves. Since I don't, again, verbalized it, and I'm going to go ahead and move on with the skill. I would then look at the wound itself. So I would pick up the wound or the dressing from the center, and I'm going to pull that away from the patient's view. And I'm going to pull that up and I'm going to note the drainage or anything that's on the wound itself. So I would note if there was any drainage or bleeding. I'm also going to note that there was one packing in there on that wound. So I would then throw all of this into the biohazard bag. And like I said, there was no drainage on there. No bleeding, there wasn't any odor, it just looked, everything was nice and clear. The wound itself looks like it is red, but it does look like it's healing. There's no drainage coming from it, and there's no, yeah. Okay, so my wound here, again, looks clean and it's ready. Or it looks like it's healing and there's no drainage and it looks like it's ready to be cleaned. So at this point, I'm going to go ahead and take off my exam gloves and I'm going to do hand hygiene. All right, I'm going to pull up my sleeves here and I'm going to start setting my sterile field now. I have all of my materials to do so. I have my 4x4 gauze pads, my ABV pad, my container of the 4x4s, my polyline drape, my sterile gloves, the swabs, my container with the forceps in it, tape, and my saline. So I'll start by setting the field using my polyline drape. In the ideal setting, I would have a separate table to set my sterile field on that would be at waist height. Working with the conditions that we have, I'm working all on the same table, but again, I'm going to try my best not to lean over that area. So I'm going to open this drape carefully. And without crossing over it, I'm going to hold it by the 1-inch border. There we go. Touching only the blue part in that 1-inch border there. So I'm going to open it away from me, open it up. I can kind of open it this way as well. I'm going to go back like this, and I'm going to lay it over my table. Now again, I'm working with space constrictions, trying to keep everything out of that sterile field. So next I'm going to open all of my other materials that I'll need. So I'll open that ABV pad. Perfect. And my sterile gauze pads. Not touching them, not crossing over them, and then gently tossing them over there. I did cross over my sterile border there. I was having some difficulty getting those out of the package. Since I did cross over it, I would technically have to set up a new drape, set a new sterile field, and start over with new materials. I'll then open my suture removal tray that has my forceps in it. This has been open for practice, but just assume we're just pretending that it's still sterile, and again tossing those materials onto my sterile field. Then I'll open up my cotton swabs and gently toss those on. Okay, so this one landed outside of my sterile border, and at that point I would have to get new materials, but I'm just going to go ahead and fix it for these purposes. Okay, so the other things that I have are my container of gauze pads, my saline, and my tape. I'm going to set my tape over to the side since that's not sterile. I also have my gloves. Before I put my gloves on, I'm gonna move this out of my way just slightly so I have room for that. But I am going to open my gauze pads here, and I'm going to open these towards me without crossing over the gauze itself, and I'll set those outside of my the sterile drape here, but I'm still going to not cross over that because those gauze pads are sterile. And I am going to open that up just a little bit more. I then have my sterile saline here, and I'm going to just do one continuous pour over my gauze pads. I'll then stop, recap my saline, and set that off to the side. Because this might be in the way of the video, I'm going to set this off to the side also. Okay, and I did notice I got a little bit of the saline on the drape. Since that is contaminated with moisture, again, it would be contaminated, but with the circumstances, I'm just going to keep going with this. I then have a package of sterile gloves that I'll use to perform the wound dressing. So I'll open those and get the package out. The outside of this is not technically sterile, so I can touch that. And I'm going to go ahead and open these up, keeping from touching the gloves or the inside of the packaging. Again, the 1-inch border there. I'm going to kind of try to fold down my border without letting the border that touches the gloves touch me. I'll then pick up the glove with my non-dominant hand, and I'll step back. And I'm going to insert my dominant hand first. Okay. And then I'm going to keep my hands at above waist height at all times. So I'm going to grab the glove from the inside of the cuff, and again step back and put my non-dominant hand in. Okay, so now I can use the outside of this glove to fix this glove because they're both sterile at this point. And I'm going to hold my hands, and I'm going to get this paper out of my way. Okay, so now that I have my sterile gloves on, I'm ready to begin my wound, cleaning my wound. I'm going to for the purposes of this, move my wound in a little bit, but I would not do this in real practice. Okay, can you, for this, will you come closer? Okay, so I'm going to start by grabbing my forceps, and I'm going to grab one gauze pad out of here, and I'm going to wring out any excess saline that would be in there, and then hold it again with my forceps. I'm going to clean from top to bottom in the center of the wound, and then discard that gauze pad. I'll then grab another one, wring it out, and clean the side of the wound from top to bottom, and then discard that one. And then I will clean the third with a third one. I'll clean the other side from top to bottom and discard that one as well. So then I'm going to just go ahead and note what the wound looks like now that it's clean. As you can see, it's red, but there's no discharge, drainage, or anything like that. It looks good now that it's cleaned up, and it looks like it is healing. So next, to pack the wound, I'm going to use my forceps one more time and grab out another gauze pad. I'm going to go ahead and discard of my forceps because I know this wound will only fit one in there. But I'm going to, without crossing my elbow over into this sterile field, which I may have done, I'm going to open up my gauze pad here. Try not to cross over the wound or my sterile field. It's working in a small space. I'm going to open this up into a single layer that I will be able to pack into the wound. Okay, so now that that is opened, I'm going to hold on to it and grab my one of my swabs here, and I'm going to kind of just bunch it to where I can start packing it into the wound. In an ideal situation, on a real wound, I would pack probably more than one into the wound, and I would pack it into the crevices and creases of the wound. I would not overpack it. As you can see, this is sticking up over the wound, but there's not much to pack into not many spaces to pack in here. But I would pack that nice and tight using my fingers and the swab. Don't want to overpack it, but also don't want to underpack it. So pack to the edges of the wound, and then it should be good. Make sure everything's covered there. It looks pretty good to me, keeping everything within the wound and not overflowing it. Okay, so that held one gauze pad. So in my documentation, I would just let the next nurse know that I used one to do this. I'm going to discard that into the biohazard bag, and I'm going to use my dry 4x4s, and I'm going to fold them in half and place them over the wound here. Make sure it's all covered. And then I will grab my ABD pad and open that up. And then I will place that over those, making sure the blue line is up. So now that I have that on, I will tape the wound in place. So I would write my date, or write the date, the time, and my initials on a piece of the tape so that the next nurse knows when this was done. But again, I'm just going to go ahead and tape this in place. Try to use about 3 on each side. Make sure it's good and secure. Okay, so now that's taped in place, I'm going to go ahead and lower the bed back down to the safe height for the patient, and I'm going to discard of all of my supplies in the biohazard bag. I would make sure that the patient was comfortable and make sure that if they needed anything, I could get that for them. Since this is no longer sterile, I could also dispose of my saline in the bag as well, because it's already been opened. So once everything has been discarded, I could get rid of my biohazard bag in the appropriate container for the facility. I've made sure the patient was comfortable, so I can also place my my sterile gloves into the biohazard bag at this point. I can perform hand hygiene, and then I would just document everything that I did, make notes on the procedure, how the wound looked, and how the patient tolerated the procedure.